Hello and welcome back to today's Real Talk. And today we are going to be looking at the adolescent and young people's healthy package. So I encourage you please to like and follow, share as we interact. So today I am joined by Kaunda, who is our sign interpreter, Clementina and Michael. I will allow them to introduce themselves.
Okay,
Hello.
My name is Michael Aberejesu. I work as a youth advocate for a regional organization, African Network of Adolescents and Young Persons Development.
Okay, welcome, Michael.
My name is Clementine Phiri. I work for Pride Community Health Organization as a program analyst, and I'm the SRHR also advocate. Thank you.
Thank you. And we have Paul Kaunda, our sign interpreter. And today's host is Hope Malambor. I'm joining you from ZYP HQ and I'm a project officer. So today's topic, we are going to look at the adolescent and young people's healthy package. What does it mean to you as a young person, Clementina?
Okay, so the healthy package of an adolescent and a young person, it's a package that is supposed to be comprehensive, and a package that has to be of quality of sexual and reproductive health services. Yeah.
Okay, thank you. So, Michael, anything for us? What does it mean, the adolescent and young people's healthy package? What does it mean to you?
Um, the Adolescents and Young People package for health is practically a standardized package across board where young people have access to sexual and reproductive health services and are not stigmatized and not discriminated and can able to get the service relative to their need of the services. Yeah.
Okay, so I've seen, Michael, you've brought out something to do with sexual reproductive. So when we look at that healthy component itself, what are some of those services that a young person should look out for that comes with the SRHR package in itself?
So, uh, in the context of my country, if you're looking at Nigeria, we're speaking about access to family planning services and
Yes.
access to contraceptives, access to counseling and discussions around reproductive health with healthcare providers. So unfortunately, there are a lot of discussions around making sure that adolescents could actually get access to those services. But those are the services that a young person should actually be able to access.
Okay, thank you very much. So, Clementina, is there anything that from Zambia's point of view we would say is part of the sexual reproductive health package for an adolescent and a young person?
First of all, I would say for us in Zambia, we have the adolescent health strategy. That is the one that we use as a standard to ensure that adolescents' needs are met. My colleague has already explained some of the issues that are actually found in the sexual and reproductive health package, which is, HIV counseling, HIV testing, modern contraception, also the issues to do with ART, because this is also a big thing amongst adolescents who are born from mothers who are HIV positive. So there's the issue of also ART. We talk about STI screening and the like. So it's kind of a complex package when you talk about sexual and reproductive health services for adolescents. Yeah. So we usually follow the adolescent health strategy.
Okay, so I can see there's a lot of likeness when it comes to Nigeria and Zambia when we look at the sexual reproductive health services. I can hear you brought out the counseling services when it comes to your HIV testing, family planning, and all that wide component. We're looking at male circumcision as a package that adolescents are entitled to as part of the the package that comes with young people's health services. So when we look at those services specifically we have mentioned today, do you think our facilities are up to date, are up to standard to actually provide these services we have mentioned? From the Zambian point of view, are our facilities up to standard to provide the mentioned services that we are entitled to as young people?
Okay, thank you so much. From the Zambian point of view, like I mentioned, we said we have the adolescent health strategy that we follow, but there are certain issues that we are aligned to ensure that, youth-friendly spaces have the standards that they have to follow when they are operating from the youth-friendly spaces to try and reach out to, fellow adolescents. But most of the time in these facilities, even if the standards have been put across, you'll find that there is no enough space for the adolescents where they can freely access the services. Like our infrastructure in these health facilities, you wouldn't find really some standalone youth-friendly space. You'd find that maybe young people, others are meeting from the tree. Only a few health facilities have the existing youth-friendly spaces, so which makes it very difficult for certain adolescents to access the service, because what I believe a youth-friendly space is supposed to be more like a one-stop center where these services can be offered, such as if I go, I seek counseling, then I need to be tested from there. If there is need to be referred to be administered ART, if I test positive, I think it has to be a one-stop center, so to say. But the standards that we are heading to, even if we say we have these, guidelines and the like, but some of the health facilities have challenges with, space here and there. So this is what we usually have.
Okay, I think I should agree with Clementina. When I look at the Zambian point of view, and we have quite all right the adolescent and youth-friendly package, and we have all these services that are maybe made available to most of the facilities that we have in Zambia. But when we look at the youth-friendly spaces, the infrastructure is not up to standard. And in most cases, we have the services, but we don't have a corner, a youth-friendly space where young people can gather and discuss certain issues and freely access their services. So maybe from the Nigerian point of view, is it the same situation you are facing as well, where you have these services, but maybe they are not fully maximized by young people due to certain hindrances? What is your status in Nigeria?
Okay, first of all, in Nigeria, there's a Nigeria National Standard and Minimum Service Package for adolescent and youth-friendly health services. It carries 9 standard package or 9 standard services that should be offered to adolescents and young people. But you actually find out that these policies are actually poorly implemented across board, and those are some of the issues. It's one thing to even we have very limited structures or spaces for adolescents and young people. And even when those spaces are there, the question is, are those services available? What
Yeah.
does the services look like in those spaces? Like, and is the environment enabling to young people? Is it welcoming to young people? So all those questions, when you ask them and you often see the reality, it's actually not the case. And the structures are very, very limited, like I mentioned. And even when they do exist, you find out that the services are not there. And then the few spaces where the services are actually there and they have adolescents and young people have a space to come together and actually access services, you see that, okay, there's a lot of improvement in those spaces. So in now and end, you see that, okay, this standard package, there's a very good policy, but it's poorly implemented. So yeah.
Yeah, very correct. So, what I'm trying to gather right now is from Zambia's point of view and from Nigeria, we can actually see that we share a lot of challenges in common. We have a lot of policy that's theoretic, and when we go on the ground practically, we still face a lot of challenges as young people in accessing these adolescent and young people's services that are available to us. So if you're joining us, please do like our page and follow, and please do ask questions. Today, our focus is on adolescents and young people's package and services as a young person. So tune in and learn what are these services and what should you look out for. And as young people, Clementina, what do you think as young people we should do to improve the status? Is there anything young people can do? I strongly believe in as much as the government is trying by all means to ensure that this package is put in place and we're able to access these services. Do you think as young people there's a role that we need to play?
First of all, I think I find it a little bit, so to say, challenging when it comes to young people on service improvement. You know, if we talk about adolescents and young people, we are considering young people, adolescents and young people who are in the ages of 10 to 24. But in this scenario, I remember the time that we were implementing the MDGI, the Millennium Development Goals, amongst adolescent health friendly services, where we had to make sure as a country to ensure that, you know, youth friendly spaces are operational, and some of the things that were, you know, agreed upon were followed and the like. But when we trained those young people in the when the Millennium Development Goals initiative, I mean the MDGI initiative came in, we discovered that young people, number one, they do not want to grow. They do not want to leave space for other young people to take up responsibility. So we find it very difficult to actually implement these services, because most of the people that are good to the youth-friendly spaces are people that are actually older than 24 years, which makes it very difficult to actually decide for young people. So I feel as young people, we also need to work together from young people from civil society organization and the government at large, where we need to ensure that we consider empowering or imparting knowledge in the pure adolescents and young people that are supposed to take up full responsibility, so that they voice out on the services and the kind of package that we want. Not Clementine, who's 30 years and above. She's there planning for an adolescent or young person who is below 24. So I think on that one, for me, it doesn't sit well, because it has to start from us, where we need to agree to say, I have grown up, let other people take up. So from there, I think that's when we can, once we engage and involve pure adolescents and young people, definitely we're going to know what kind of issues we need to attend to or address. Yeah, so it's the involvement and engagement of pure adolescents. Yeah.
Okay, thank you. Well
Yeah.
spoken, Clementina. And I think some of the challenges most adolescents and young people face, like you mentioned, is maybe not wanting to fill up these spaces. Because in as much as Clementina wants to leave the friendly space, that is the next adolescent capable to take up the responsibility of managing the youth-friendly space, of advocating for what type of services you want to see as a young person. And are you even utilizing, are you making use of the services that are made available to you as a young person? So most of the facilities we have, especially down here in Choma, you'll find we have a number of facilities that have the youth-friendly spaces available. But when you look at the attendance of these adolescents and young people in these spaces, it's disappointing sometimes. So you find you have people who come together and ensure that they try to manage the youth-friendly spaces. But as young people, as adolescents, we are not playing our part in accessing these services, in making use of these services. And as a result, you find we act as our own hindrance when it comes to accessing the adolescents and young people's package. So thank you, Michael, for joining us. We noticed that you dropped out along the way. You are welcome.
Yeah, my apologies. Like, I had some
So,
technical difficulties, so.
okay. So from your point of view in Nigeria, how is the response when you look at the services, the adolescents and young people's healthy package? What is the attitude of young people when it comes to accessing these services?
So, in Nigeria, the perspective from young people is what they probably feel that they will go to the facilities, and they have a perception that, okay, if they go and access sexual and reproductive health services, to what extent would they be approached at the level that, okay, it's encouraging, and to what extent would they even not be stigmatized, and to what extent will the healthcare providers even respond to them. So there's already a perception of stigma, and at
Yeah.
least yes, when we talk about when we talk to young people, we find out that they have issues, and it comes from a very strong perception of stigma, which then speaks to how, to what extent do we even get the community involved when it comes to awareness on the need for adolescents and young people centered healthcare provision. So, do we create awareness to the community? Because we find out that there's a lot of social norms, cultural beliefs, as well as religious discipline infused in whatsoever stigma that has been dished out by the healthcare workers, because the healthcare workers are part of the community, and it's not
Yeah.
just enough to sensitize the healthcare workers, but also create a lot of awareness to community gatekeepers, community influencers around the need for adolescents to actually receive this specific type of services, because the community has a very strong influence culturally, socially, as well as religiously on the stigma that's being dished out to young people when they go to these health facilities. So, yeah.
Okay, Michael. So I have noticed that Michael keeps on bringing out the word stigma in his conversation. So it really gives me a picture that when we look at Nigeria, there's a lot of stigma when it comes to young people accessing, especially sexual reproductive health related services. And I think for Zambia, that was one of the major issues we were dealing with some time back. And I want to feel as time has gone by, we have made some improvement when it comes to the attitude of health
Mhm.
workers, when it comes to
Mhm.
providing sexual reproductive health services to these young people. And we have improved, but definitely there is always room for improvement. So a lot of stigma, a lot of people still feel I cannot go to the health facility and request for condoms. I cannot go to the health facility and tell them I want an HIV test because you're going to be associated to a young person that's not living right, a young person who's not very responsible of their sexuality. And you can't go in a facility and request for services like PrEP or PEP because you feel you are going to be judged and society is going to judge you. So looking at all those angles, all that stigma, the society, the religions and practices we we practice have an impact on these young people coming through to access health services. So maybe from the point of
Hope,
Clementina, maybe I should
can I
hear.
just say something from what Michael has already
Yes,
alluded to?
go
Yes,
ahead.
he talked about the engagement of, these religious leaders, the community people when it comes to, try to improve adolescent friendly health services. I think you've talked about the issue of stigma, where as Zambia we've tried by all means to ensure that stigma at least has reduced. But I also want to echo an important point. When we are planning for the adolescent health services, we need to ensure that we engage these civic, traditional, and religious leaders in the planning. You cannot just be reaching out to an adolescent, leaving these key people who are very influential on the ground. So once we reach out to these people, we're going to bridge the gap or barriers that hinder adolescents and young people to access and actually utilize sexual and reproductive health services. So I feel it's very, very important, even when we are planning for adolescent health issues, don't just target adolescents, but a parent at home is supposed to know what kind of package is being offered to this adolescent when they go to the facility, so that we are all moving at the same pace and we have a proper understanding. Thank you.
Thank you very much. That is actually very much correct, Clementina. I mean, when we look at the influential people today, those are the people that drive policy in place. Those are the people, the right key people we can target to actually enforce certain decisions to be put in place. And if we take the approach of engaging traditional leaders, religious leaders, politicians, and all these people, I think that would be more beneficial for young people. So I remember Mutokwa mentioned that she agrees with you. Most of these youth-friendly spaces we have are occupied by people who are 25 and above. And it's high time that young people, adolescents, come on board, make yourself available, and access these services. So if you are just joining us, please, you are welcome. Kindly ask questions and share our live. So Chisenga says, one-stop centers, yes, but we have issues surrounding CSE. Kindly, as a start point, kindly enlighten us on this one. So, okay, I think we're having some technical challenges. Clementina, are you there?
I'm here. I'm here.
Okay. Michael, are you there? Can you get me?
Yes, I can get.
Okay. So the issue of having people who are over 25 in youth-friendly spaces. Clementina, you made that mention. What are some of what's the impact due to that? What is the future impact?
Um, I think if we have youths that are above 25 in these youth-friendly spaces, I feel the services would be compromised and will not be able to reach out to the right audience. Yeah, so I think there's just an approach that we need to take. I don't know how best we can work around it to ensure that we really closely maintain adolescents and young people who are supposed to speak for their own needs. But
Yeah.
I see why this has been a very big problem because most of the young people do not actually have anything that will keep them ongoing. Probably they want to be in these youth-friendly spaces, which maybe if there are any activities ongoing, maybe there are sensitizations that probably will provide for them a lunch, that will enable them get airtime. So I think that's what
Yeah.
keeps going because they have nothing literally to do. So no wonder it's a challenge. So we don't want these services for adolescents to be compromised, but we need to ensure that we reach the right audience. So I think as CSOs, we really need to work around this and see to it that, we reduce the number of the age of young people that are actually found in these youth-friendly spaces.
Okay, thank you, Clementina. Michael, coming back to you. You mentioned a number of services that are being provided in your country for adolescents and young people. What are some of those services that you find likable as a young person? And are there any proposed other services you would like to see being incorporated in the adolescents and young people's package?
Okay, so I personally, if you look at, there are several programs that have been put in place for adolescents and young persons. Like if you look at, we have a program that's an OTZ program. I don't know if it cross across Zambia as well, which is zero missed appointments, zero missed drugs, and then zero viral load. So those kind of initiatives have been proven evidently that okay, it actually helps young people. If you see from the inception of the program, viral suppression among adolescents and young people moved from 61% to about 91%. That evidence actually shows that that's a very, 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 very effective program since its inception. So for me, I personally, that's something that I would like to see done at scale, like at a very, very big scale, and because it gives the opportunity for young people to actually learn from people who have gone through a lot and actually have an effective guiding system as they transition from younger adolescents to older adolescents, and it keeps them at bay, gives them a safe space, and allows them to know how to approach certain cases and how to approach healthcare providers when it comes to assessing certain services. So that's something that I would like to see done at scale, possibly nationwide. So yeah.
Okay, thank you. So we have a comment from Mitchell. Mitchell's comment says, I wish sexual reproductive health and rights can be implemented in churches to especially that the time youth-friendly spaces activities are done, most adolescents are in school. If we are to spread the message, then we need to tailor the time and venue of these activities to our target groups. Michael, what do you have to say about this? Okay, I think Michael is having technical difficulties. Clementina, any comment on Michael's proposition?
Mitchell's
Yeah,
position. It's actually a very, very good point, but from the Zambian aspect, I would say only a few churches would invite you to, give these talks, but some
yeah,
other churches really don't do that. So you'd find that from the 100%, probably maybe 25% churches are the ones which will, engage different people to talk about adolescent-friendly health services. I've done for the Zambian Girl Guide. I've given a talk before on the sexual and reproductive health package when they had their, national rally or something here in Kafiwe. That was last. It was really a big crowd. Where I think there were 1,000 number went there to talk to the young girls who are in the ages of 10 to 24. It was something amazing because I never saw it from other churches where a big crowd got in one place from different parts of the country. And then you talk to them about adolescent friendly health services. And you also tell them, of course, it can't be, a service cannot be dispensed at the church premises.
yeah,
That's illegal. That's prohibited, so to say. So it's better if information is given, then you connect them or link them to say, oh, they're actually in your area. There are these existing youth friendly spaces where you can actually access such of the services because young people they're supposed to be treated with so much care, so to say.
yeah,
If I want
true.
to say somebody should not be able to embarrass me to other people to say Clementine, as young as she is, 15 years or 16 years, she came to collect a contraceptive. I'm not supposed to be treated like that. I deserve the confidentiality that I need. So I think it's just some few churches who are actually trying to promote the healthy aspects of the adolescents and young people. But some other churches really, I don't know where we're heading to. So I think this calls for actually advocates where uh, we need to, as civil society, we come together and advocate if maybe we can be going into these churches because in a
Yeah,
church, that's where we find a large proportion of adolescents and young people really. So even from a church where I come from, there are lots of, young people, adolescents,
yeah,
the numbers are packed here and there. So I think it's something that we need to do as going forward. The approach has to I don't know what approach we're going to use, but it's just up to us. It's always in our hands as civil society. So we can discuss here, but we need, full engagement and involvement of everyone.
yeah,
Thank you.
true. Very interesting. So I totally agree with what Clementina says. I kind of feel church has a lot of influence on everybody. And if the church can be involved and if the church can be open enough and willing enough to welcome a number of advocates and people that just want to speak out when it comes to adolescents and young people's sexual reproductive healthy, the church can act as a good channel, so to say, to bridge the gap when it comes to young people's poor access to these services. And if given an opportunity, and if most churches can be open to the idea of opening up their space and allowing these young people to be educated in those areas, then I feel as adolescents and as young people, we might be helped in such a way in being able to access those services that we need. Michael, any final remarks as we wind up?
Okay, so just to chip into the discussions around the churches. Uh, Faith-based organizations are a very critical part of the program and the structure when it comes to helping out, especially as a link to the churches as well as the educational system. In country here, you see that a lot of churches owns most of the schools, the secondary schools, which if
Yeah.
we could get them strongly involved in the adolescents and young people's discussion as those faith-based organizations, it will really be impactful because they have a very strong network with the churches, they have a very strong network with the school. I think a good place to start would be getting the faith-based organizations on board when it comes to discussions around adolescents and young persons, so that they could see the need to inculcate these discussions in churches as well as in those educational systems that they're involved in. So, yeah.
Thank you. Okay. Clementina, anything to the young people, adolescents, and young people with regards to today's topic?
I think a lot of adolescents and young people are listening out there. I see the comment from Mitchell. I see the comments from Miranda, Natasha there. We are the young people that are working with fellow young people in these districts, different communities. So I think the ball is in our hands to try and ensure to be a little bit more innovative when it comes to adolescent friendly health services. So the ball is in our hands. It also takes passion and commitment for us to perform this work and to ensure that we create a conducive environment for adolescents. So I think the onus is on us. We really need to work hard as young people who are listening to better our communities and to better, our countries, so to say. Yeah.
Okay. Thank you very much. So today's topic we had focused on adolescents and young people's healthy package, what it means to you as a young person, and just simply understanding from Zambia's point of view what really is this package, and from Nigerian point of view what is their package and what is their situation on ground. So thank you for those that have been watching with me today. I was your host, Hope Malambo from the Zambian News Platform. Kindly join us every Friday, same time. We look forward to interacting with you. Thank you and see you next time.